Hello, my name is Shagun. Today I'm going to be talking about Trisomy 21, commonly known as Down syndrome. In the United States, Down syndrome is the most common type of congenital condition. It is associated with intellectual disability. It was first described in 1866 by John Lander Down. In 1959, Jerome Lejeune and Patricia Jacob discovered a triplication on chromosome 21 as a cause of Down syndrome. Each year, approximately 5,300 babies with Down syndrome are born in the United States. Over 200,000 people are living with this condition. About one-third of school-age children suffer from this condition. This condition is associated with multiple systemic and physical complications, which can often lead to functional disabilities. Individuals with Down syndrome often present with various clinical presentations. They have shortened extremities, joint hyperflexibility and hypotonia, short neck and dysplastic ears, flat occiput and flattened facial appearance, short, broad arms, hypoplasia of the middle phalanx, and cladodactyly. Also, we see large furrow tongues, which cause the mouth to remain partially open. About 40% of individuals with this condition do have congenital heart disease. They are more susceptible to respiratory infection and they have a higher rate of leukemia compared to the normal population. And also in this population with Down syndrome, there's a higher risk of developing Alzheimer's disease later in life. Down syndrome can be identified through prenatal screening at certain stages of the pregnancy, which is usually followed by a diagnostic test to confirm diagnosis of this condition. Some of the diagnostic that is done for Down syndrome includes amniocentesis, which is usually done about after 15 weeks of pregnancy, and chronic villus sampling known as CVS. This test is usually done about between 9 and 14 weeks of pregnancy. And the last is percutaneous umbilical blood sampling known as BOBS, which is usually done after 18 weeks of pregnancy. There's no inheritance pattern that causes Down syndrome. Down syndrome occurs by random chromosomal abnormality that takes place during formation of reproductive cells. This abnormality is known to occur in egg cells, however, can occasionally occur in sperm cells. Over 90% of extra copy of chromosome 21 comes from egg cells, while about 4% comes from the sperm cells. This error in cell division is known as non-disjunction. There are three classifications of Down syndrome. The first is translocation Down syndrome. In this type of Down syndrome, unaffected parents can carry a rearrangement of genetic material between chromosomes known as balanced translocation. They can then pass these chromosomal changes to the next generation as unbalanced translocation, and inherited unbalanced translocation in chromosome 21 can cause Down syndrome. The next is mosaic. There is there are no inheritance pattern in this type of Down syndrome. This event occurs at random during cell division in the early stages of fetal development. The last is complete Down syndrome. This event happens during the formation of the egg and sperm, in which either one having an extra chromosome, the unification of the egg and sperm produces a complete extra copy of chromosome 21. Another risk factor for Down syndrome is maternal age. There is a possibility that an egg with extra copy of chromosome 21 increases as a woman gets older. Young mothers have a low chance of having children with Down syndrome. As women age increases, the possibility of having children with Down syndrome increases. At age 20, the likelihood is 1 in 2,000 births. At age 35, the likelihood is 1 in 111 births. And at age 45, the likelihood is 1 in 33 births. To date, there is no cure for Down syndrome. Management of this condition involves a multifactorial approach from a various team of health specialists and parents of the individuals with this condition. Early intervention is imperative to improve the overall developmental and cognitive skills of this individual. A timely involvement of specialized health team at various age development of the child is important. Parental and support group as well as specialized educational program for cognition and intellectual development is important and key to this individual. Provision of good home environment and parental care is also key to the functioning of these individuals. Socially, people may have an implicit bias towards individuals with Down syndrome. Many people in society have limited knowledge on how to communicate with individuals who have this condition, as level of cognition and intellectual capabilities varies among these individuals. While they are prenatal screening for and while the prenatal screening and diagnosis for Down syndrome, the ethical dilemma is that is it morally right to abort a pregnancy after positive pregnancy test that confirms a diagnosis of Down syndrome? Studies report that over 90% of women in many countries resort to abortion after a positive prenatal test that confirms Down syndrome. Seems like modern day eugenics. Just on a side note, I just read this week that the state of Ohio is trying to pass a bill that will prevent women from aborting their pregnancy after a positive prenatal test that confirms Down syndrome. Sounds like a very ethical dilemma that we have to deal with. Anyway, that was just on a side note. One study did reports that medical costs do increase in the first 5 years of life of children that have Down syndrome, and the cost tends to reduce as the child gets a little bit older. And if the child has a lot more complication, there's an increase out of pocket cost for the health of this child. And references, please leave your feedback. If you have any question, you can add that as well. Thank you.